And it's 8:15, and good morning to you. So glad you are along. We've got a lot of great information and informative matter here to talk about. Here's Paul Harvey from Christus Mother Frances Hospital. Good morning.
Good morning.
Thank you for coming in. And you are just a world of information for us. And we want to know what we need to know about COVID and our hospital.
You bet. Well, as we know, there's a lot going on with COVID throughout the country and in the state of Texas. Just know that here in Sulphur Springs, Christus Mother Frances Hospital here in Sulphur Springs, we are taking care of the COVID patients that are entering our doors. This morning we had 13 COVID patients here. We are still able to take patients through, if they come into the emergency room or walk in, still doing our outpatient procedures that help our patients get better. We do not want to go to a stage, if you will, that we're not able to do elective procedures anymore, because that, in our opinion, deters people from getting their timely health care, regardless of whether COVID is going on or not. So our goal is to make sure that we continue to provide a safe environment for our associates and the patients, especially if you have COVID. We've been doing this now for 15 months. It's peaked a little bit now, but we are, holding our own, and I'm very proud of our team, our physicians, our clinicians in what we're doing in taking care of our patients.
Okay. I know in every press release that you send out in weekly, at the bottom it says, we are a safe environment. We are already carrying the same procedures for COVID as are just necessary to do all the time.
Exactly. Because you don't want to, I think the thing they found during the last 15 months of the pandemic is people were delaying their health care because of what they heard in the media or what they felt they couldn't do, not coming into a safe environment. And we just want to ensure our community and our service area that we will continue to provide that safe environment for that. Now, that does require, since we've had a rise in COVID, we're having to limit visitation again like we did. But for the most part, people have been very understanding. We are back to full masking in the hospital, but that's only for our associates' protection and our patients' protection. So with that in mind, we continue to meet the needs of our community every day.
Well, and that brings up your clinic every Friday for COVID shots.
Yes, so we continue to let everybody know that every Friday, until further notice, from 9 to 11, we will continue to provide COVID vaccine shots in the front lobby of the hospital from 9 to 11 every Friday until further notice. And this is last Friday we had this, and we had 71 patients or people show up. And so we're seeing a little rise in the number of people that are wanting to get the vaccine now, et cetera. And that's a good thing, because as we know, it's one way to help keep the COVID rise down if people do get the vaccinations. But that is a personal choice.
People who have formerly said they wouldn't are now getting.
Yes, we're seeing a lot, and we're seeing younger, kind of the younger generation. What's happening is a lot of the patients that are hospitalized are younger than what we saw during the last 15 months when COVID was peaking last year, and most of the people being hospitalized are not vaccinated.
Right.
Kind of an interesting, see that, but that's kind of. That we're kind of seeing that is, the vaccine can make a difference in that.
And that is good to know. We have several things to talk about in such a short time to do it, between now and 8:30, but some people are hearing that hospitals around us are closed.
Right. Well, with the surge that's happening, I think in Hunt County, for example, they've had to close the ER hospital in Commerce to be able to pull staff down to Greenville, to Hunt Regional, because they're having a big influx of COVID patients, and every hospital is struggling to make sure they have the appropriate amount of staff to provide that safe care, and that's the way they're making that. They've made that determination, and we want to ensure the people of Commerce that they also have another option to go, and that's to Sulphur Springs for their care from an ED perspective as well, to help out in this time of need that they have. There's another ER hospital in Rockwell that closed for the same reason, part of the Texas Health Resource System as well. So that's the only ones that I'm aware of. I can tell you, all of our other ones in our system here in Northeast Texas that doors are still open. We do have a great influx of patients, so everybody has a lot of COVID patients they're treating right now. And one of the difficult things right now is for people needing high-level care. There has been some delays, and it's just not within Christus, but in all of our health systems because of the influx. Because of not making sure we have enough staff to take care of those patients and to ensure that there's a bed when they do go to another facility, that a patient can properly receive the care and in a safe environment.
Okay. So, of course, healthcare is in the news right now. We happen to be in a celebration, city and county, in this community health care providers, healthcare centers, and you have one.
Yes, our partner with our community health center, CareVide, is it's Community Health Center Celebration Week. Their annual do, and they always do that, I think, right before school starts again, and so we partner with CareVide to really enhance our access for our patients, for women's health services, for pediatrics, and for primary care.
Okay. Something else we hear on the news is elective procedures at hospitals, maybe being
Right. Well, the Governor Abbott just came out late yesterday with some information about that. I think around two things that I'm aware of. One is I think they are going to look at helping hospitals with bringing in clinical resources, especially from out of state like we had last year. The second thing is he's asking for those hospitals that are in dire need and are overrun by having to deal with COVID to make sure they have enough hospital beds to take care of those COVID patients, to, delay elective procedures when it's not a life-threatening or a deterrent of care for that specific patients. And in our hospital here in Sulphur Springs, we're not, our mission is not to get to that point at all, and we feel like we're doing that in the right way, the respective way of making sure our patients are safe and that we don't delay their care.
When COVID happened to us the first time, we weren't already in a trend of offering help because we didn't know what we were working with. That's not true now. We have vaccines in plentiful supply. Mm-hmm. We have ability to get them to the people, and so we're already on sort of the upsurge there as COVID climbs again. Right.
And it's kind of interesting, again, because you're seeing a lot of these people that are getting the COVID are a result of being unvaccinated, especially if you need the higher level of care, and those are the ones that are we see more in the hospital. I think if you've been vaccinated and you do get COVID, it at least the majority don't seem to have the same severe symptoms like you do if you're unvaccinated. And so that we didn't have that last year. We did not have that two level of care, if you will, or care availability, because we didn't have the vaccines last year.
And we as just people, and we as in a Christus area here with our hospital, have learned a lot.
We have, and it's like, you're never too young to be able to learn something new. And I think, this last 15 months, especially anybody tied to healthcare, no matter what role you have, you've seen something you've never seen in your life before. And I think that's what we had to get our mindset around as healthcare workers, to be able to take this on from an onslaught of dealing with the pandemic-sized portion of a disease that we didn't know much about, and that hit us pretty hard.
Well, as COVID concerns expand and other items will come into the news probably on a daily basis, sort of like fundamentals. When you're starting out football again, you do the fundamentals. We want to get vaccinated. We want to wear our masks, and they're fully masked, as you mentioned, inside the hospital facility.
Mm-hmm. That's right. I think, I think it's some of the same things that we've done over the last 15 months about the masking, the social distancing. I think some of that is, obviously that is still very, very appropriate in certain settings. But I think, we need our kids back, and I'm personally, I think we need our kids back in school. We need those activities. I think we can do that in a safe environment and still have the participation that we've had. And so that's our goal, is to support any way we can our community partners in that way.
Well, people may have just simple questions to ask. Do we have beds and staff in our hospital and through the Christus system?
Yes. Well, we have available beds here. We've been able to, during the COVID time, hospitals had to rethink, how you take care of patients, especially those that have this specific tie to COVID versus the non-COVID, to make sure you have separation to be able to take care of them appropriately. And we have that, and we've been able to do that and still take care of, for example, those critical patients that are not COVID. They're still being taken care of in our intensive care unit. And that is our goal, to make sure that we continue to provide ways to have that safe environment, a little bit of separation, so you ensure that those critically care patients can be taken care of regardless of whether they have COVID or not.
We also remind again about the clinic, the shock clinic, every Friday.
Every Friday, 9 to 11 in the hospital front lobby. We have right now, as of today, we have all three of the different shots available, from Moderna to Pfizer to Johnson & Johnson. And unfortunately, we have a lot of those that will be expiring in the next 30 days. But we're trying to ensure that we get more as well. So I want to be sure that the public, our family members, et cetera, know that they can have access to that from 9 to 11. I think, I know some of the pharmacies still provide those, and that's great, and people can go to the various pharmacies as well. But just from our perspective, we made a concerted effort to be sure that we have this available every Friday from now and until further notice, from 9 to 11 in the hospital front lobby.
So if you haven't gotten your vaccine, please consider doing so.
Yes, ma'am.
It's absolutely free.
It's absolutely free, yes, ma'am.
And if you would like to give the gift of life, Christus is also hosting a blood drive by Carter on August 18th.
Yes, ma'am. We partner with them probably once or twice a month now. Blood is in short supply, so if people are willing to do that, come out and they'll take very good care of you.
Thank you very much for coming in and explaining.
Thank you for having us. And it's everybody has to make their decision. We just want to ensure the people in our service area in Sulphur Springs that we're here to take care of our patients, regardless of whether you have COVID or not.
Thank you very much, Paul Harvey.